Welcome back to Great Day Washington. Today's Miracle Monday deals with a more serious topic for everybody, the Zika virus.
That's right. Experts are learning more and more about the virus, and here to share what you need to know is Dr. Roberta DeBiasi. She is Chief of Infectious Diseases at Children's National Health System. Welcome.
Thanks for having us.
Now, first of all, there's a lot of mystery and confusion about what the Zika virus actually is. What is it? Where did it come from? And how does it affect the body?
Zika virus is a virus that is transmitted by mosquitoes. So there are other viruses that we've heard of called dengue and chikungunya and all kinds of interesting names, but this is a new virus that has now emerged in the Americas transmitted by mosquitoes. Now, what it causes in the vast majority of patients is really a pretty minor illness. So they'll have a fever, maybe rash, their eyes may be red, their joints may be achy. It'll last about a week and they get over it. But what's really been concerning to us is that when a pregnant woman is infected with Zika virus, there are potential consequences to cause birth defects, primarily in the brain of the fetus. So this is really the vast majority of the concern and why it's been declared a health emergency by the World Health Organization.
Yeah, it's heartbreaking to see those videos and there's those children with the birth defects there.
Yes.
So hopefully we'll get out there and clean that up. So what about traveling? If you or a spouse or something is traveling to a high activity Zika virus area, what do you do?
Well, that's a great question. And the first question is, where are these areas? So right now, many parts of South America, Central America, the Caribbean, and some of the U.S. territories like Puerto Rico, American Samoa, the U.S. Virgin Islands are areas where there is actively circulating virus. So if you are going to those areas and you are thinking about getting pregnant or you are pregnant, you should not go. I mean, it's very simple. If you are going to go, meaning you're not a pregnant woman, or if you are a partner of one of those, of that category of a person, you need to take precautions to try to avoid getting infected. And that essentially means stay indoors as much as you can with air conditioning, use screens if there's no air conditioning, use mosquito repellents that are EPA approved, and those are things like DEET, oil of lemon, eucalyptus, or what you don't want to use are things that are not EPA approved because those have not been proven to prevent mosquito bites.
Now, if I want to just be clear about this, so you're saying if your spouse goes to one of these countries and is infected with Zika virus, is there a possibility that it's an STI or an STD?
Yes, and this has been one of the really active areas of research. So the vast majority of cases are really due to a mosquito directly biting you. But we have seen cases across the world, and even in the U.S., we've had about 10 cases where it looks like it was sexually transmitted, meaning the pregnant woman or the person who got the infection did not travel anywhere, but their partner came back from one of those areas where they were infected and then transmitted it. What we think right now is that it can remain in sperm for up to 2 months. So what the CDC is currently recommending is that if you are going to one of those areas, a male, and you come back and you have a pregnant or possibly could become pregnant partner, that you avoid sex or use condoms for 6 months after the return.
Wow, it sounds like a deadline. You said 2 months there. How long does this virus last?
These are all questions that we are actively working on. Up until about a week ago, when we published our recent case of a pregnant woman who was infected, we really thought it only stayed in the blood for about a week and maybe 2 weeks at most. But unfortunately, there's our case and other data that are coming out, for instance, that in some women, we have found virus up to 10 weeks after infection. So this is all a moving target. You'll hear new stuff coming out all the time. I'll let you know that the whole world is working on this and everyone is working very collaboratively. Our case, we worked with people in Finland as well as CDC and here in DC as well as Baltimore. So we're all working hard to get these answers.
If I can do a follow-up, I'm
Sure.
sorry. I know, I'm not a doctor, but I know viruses start getting stronger and they start adapting. It's like, oh, is that a medicine? All right, I'm adapting, and then there's a chance of that happening too, right?
Yeah, and what you're talking about is mutations.
Right.
So viruses are basically a piece of DNA or RNA, and they are smart. They learn to survive by slightly changing their sequence. And we have seen some small changes in the sequence of this virus even in this year since it's emerged in the US. But for the vast majority, the virus is pretty much the same strain that it's been. But again, we're keeping a close eye on that as well.
Thank you so much. I'm sure there are lots of parents, grandparents watching. They want to protect their babies disease. I've seen those devastating pictures. Where do people go for more information?
You can use the CDC's website, but we also at Children's have a website that is devoted to Zika, and that's childrensnational.org/Zika. We also, I'm part of the Fetal Medicine Institute at Children's, and we have neurologists, radiologists, infectious disease, multidisciplinary evaluation that's available to any pregnant woman who's concerned, and that's childrensnational.org/fetal.
Good. You also have a telephone number, though. I want to get this. It's 202-476-7409. 202-476-7409. Very hot topic. Thanks for, and get out there and get them, okay? Get this virus. Do something about this, please. Thank you very much for coming on Great Day Washington.
Thanks.